is taking, is the worms inside him that will be taking it.
Is there a tendency that a child that has this kind of ailment that is similar to kwashiorkor, is there a tendency that they look healthy even though they have this particular disease? Can they look healthy or they will not look healthy?
Kwashiorkor children does not.
And they keep saying, I'm not filled up, I want more, I
More,
want
more,
more, I want
yes.
more.
But this soil transmitted vomit, there is small difference between the soil transmitted vomit and kwashiorkor children, because when the research said that we should treat in schools, we started giving out deworming drugs. And any child that is suffering from this soil transmitted vomit, immediately the child will pass out worms. After taking deworming drugs, the child will pass out worms.
Worms?
Yes. Not even one, not two, not three, multiples.
And they want to be moving like this?
Are live worms.
Okay.
And you will see them moving.
Okay.
There is one that one of the children in one of our local government passed out, that some of them were calling it spaghetti.
Hope they do not eat.
It's because it's moving. You know, spaghetti cannot move.
Okay, thank you so much. If you are just joining us, is helpline on OJBC 90.5 FM. You can be part of the program. We're talking about neglected tropical diseases, and we have Nurse BC Fanaya in the studio that has been telling us about onchocerciasis, trachoma, and so many other neglected tropical diseases. You can be part of the program, but eventually you have any question, there's something you're not clear about, you can actually call in 003 437 9453 003 437 9453 or 0815 032 0226. Those are the numbers to call if you want to ask any question. Now, how can, I mean, it's kind of scary, all these ailments, diseases that you've been talking about. How can it be prevented?
Research says that we should treat all, because research gave us.
All right, let's quickly pick this call. Hello? Yeah, good afternoon.
Good afternoon, madam.
Good afternoon.
This is Alaska on the Andrew from Apartment Township. Yes, you are about to start answering my question. I want to ask you that is it curable, is it preventable, and how can we cure it? So we are about to answer those questions. Okay, please. I'm dying to listen. I'm dying to hear from you. Thank you very much.
Okay, thank you so much for calling, sir. All right.
All right. Go ahead. Thank you, sir. The diseases are curable.
Okay.
And the only way that we can cure it is just to be on the drugs, because the research says that whether you are infected or not, everybody must be on treatment for like 10 to 15 years.
Now,
once in a year.
Let me just cut you short. I'm sorry. Before you talk about the cure, how can it be prevented?
Okay. Lymphatic filariasis can be prevented by sleeping under mosquito nets.
Okay.
That is where collaboration with malaria people comes in.
All right.
Because malaria people are in charge of nets, bed nets, we are in charge of drugs. And this diseases is not written on our forehead. Maybe you have it or not. Because some people will say that, did I tell you that I'm having onchocerciasis? During implementation, during the distribution period, they will be telling us, charge. We will take it to their doorstep, free of charge. Tell us that we don't need. Yes. But this thing, before manifestation, it depends on individual immunities. If your immunity is strong, you might have it in your body system 15 years without manifestation. Those people with elephantiasis, it's not immediately that the mosquito bites them that manifestation starts. Okay. It's not immediately. It might be. So at least some of our patients say that it was when they were in the village. And after leaving the village, they get to the town, they got married. So manifestation starts.
Okay.
So it's not immediate something. It's not like malaria fever. It's not. You think 20 years without manifestation. Wow. But before the manifestation occurs, if you are on this drug, it will not manifest. Because these drugs is like an immunization.
Okay.
You know that our children, babies till 5 years, they are on routine immunization. So this one from 5 years and above. So it's like immunization. It's like people will call it ajesara. So even if you have the symptoms of those diseases in your body
As long
If
as
you are on drugs, it
Mm.
will not manifest.
Now, you mentioned something about a certain mosquito that's for lymphatic,
Lymphatic
something like that.
filariasis, yeah.
Okay, now you said we must use
Bed net.
a treated net. So now, of course, if you're going on the road, mosquito can still bite you.
Mosquito can bite you because we normally tell people in our rural environment that you should try as much as possible to walk every very long clothes. Even going to the farm, they should use. We realize that this thing is so common in rural environment, but we normally deals with them because in the 20 LGAs in Ogun State, we are implementing 19 for lymphatic filariasis.
Okay.
Implementation is going on in 19 LG and it's just once in a year treatment
And after that, there's no.
every year.
Now, you mentioned something about a certain mosquito that causes elephantiasis.
Yes.
That's kind of scary. I
It's
mean,
not
but how can one know which
You can't
mosquito?
know, you
Ah.
can't know them because we have 3 different types of mosquito. We have Anopheles,
Yes.
Aedes, and Culex. You can't even if one should bite, you don't know
You
maybe
might
it's
not know which
Anopheles
one
or
or
Culex
not.
or Aedes.
Okay, so that means how can one prevent? That means by taking those
The
drugs.
drugs, yes.
Okay. Now, for those who already have the ailments, the diseases, they have to get to where to
Yes.
be able to get the drugs.
Okay. Our office is situated at Block C, room 336. Block C, room 336, and the drugs are available for everybody
Okay. Is it for free
for
or
free of charge
all right?
from 5 years and above.
So now, how effective has been the sensitization? I mean, going from one rural area to the other.
Okay, at least for this round, we are like 21 years that we've been doing this treatment.
Okay.
So, and it's year in, year out. By the time we want to start our implementation, we move down to the then we allocate drugs to them. We use number of days, we use like 7-10 days for this distribution
Okay.
in all the LGAs during our implementation.
Okay, there's something I want to know, but let's go on a break. We'll be right back.
BJ,
Yes,
o fẹ́ kí commercial.
you said we should go on a break.
Was doing justice to what we're talking about today. Now, what happens when people do not go for treatment? Of course, when they start seeing the symptoms and everything, and they refuse to go for treatment. What happens?
At least.
Oh, let's quickly pick this call. Hello.
I don't get sorry, can you tell us that will be back again?
Thank you,
I'm
sir.
not joking.
All right.
What I said that not
Busy.
what do you call it?
Busy.
Is there any limit that affect anybody? Because could be youth, could be adult, could be adolescent, could be all. Is there any age limit to you understand what I'm saying?
Yes.
Yes, sir.
Yes,
Yes.
sir.
Thank you, sir. All right.
Okay, thank you so much, sir. These diseases that we're talking about has no age limits, but the ones that it is very rampant among the children is the one we are doing in school from ages 5 to 14.
Okay.
But this study gave us the information that some of the LGAs in Abeokuta, in Ogun State,
Mm.
the prevalence is high.
Oh,
So we have to treat everybody, including adults.
okay.
So all these are the ones are those things that we put into consideration during our implementation, because those LGAs that the endemicity is very high, we treat both the young and the adults. And I said it that all our drugs is from age 5 and above. So no age limit. When the child is 5 years, is able to take the drugs.
Now, can a baby contact any ailment from the mother
No. It's not transmitted from one person to
to
another.
another? All right, thank you so much. So, we're still talking about diseases, and we would want to know is most common in Ogun State.
Ma,
Oh, okay, I know you
one,
mentioned like two.
I
in some rural
mentioned
areas.
4,
Yes, two in
but-
some rural areas. Yes,
but co-endemicity is in all the LGAs.
all.
Yes. All the LGA. Is either 1 or 2. We don't have LGAs that has just 1. We have multiple. Like maybe okay, if an LGA is having schistosomiasis, the LGA can as well have onchocerciasis and lymphatic filariasis, leaving behind schistoid transmitted helminths. So in all the 20 LGAs, I mentioned earlier that we are doing treatment in 19 LGA for lymphatic filariasis. The only remaining LGAs that we are not doing lymphatic filariasis is doing schistosomiasis.
Okay.
So it's interwoven. It depends on the result of the research. But in all the LGAs, that is how it is.
Now, talking about children and adults, who are those that are susceptible to any of these diseases? Is it more of the children?
I
or-
said it that more of the children are eligible for schistosomiasis and soil transmitted helminths.
Okay.
Because as an adult, seeing a dirty environment, you can't pick something from the floor and put it in your
The
mouth.
children would
But
definitely
the
do
children
that.
will do it. So it's that one, the two diseases are most common among the children.
Oh,
Schistosomiasis and soil transmitted helminths.
okay. Now, for people that are living in rural environments, some people don't even have access to getting all the necessary information, So, but how do you go about doing this?
All right. In all the 20 LGAs in Ogun State, we have coordinators that are handling all these diseases.
Okay.
And they're the one that will come to the state to train them every year.
And it's been effective
Yes.
so far.
Yes.
All right. Now, so everyone out there who is listening about these blessed tropical diseases, what advice do you have for them so that they will not, contact to the extent that they'll have to start, going one place to another to get treated?
All right. The first advice I will give to my people is that we should try as much as possible to make our environment clean. Because sickness cannot stay in a very clean environment. And if our environment is clean, the breeding of mosquito will reduce. Then the second advice I will give to them is that they should try as much as possible to drug acceptability of these drugs.
Okay, not that they
Yes.
start giving an excuse. Just
No,
this is for free anyway.
it has no harms in taking it, and it's free. You are not asked to bring money. Anytime that people just knock at your door, okay, we are here to give out these drugs, please, our people should take it and make sure they use it, because some people will take it
And
and
they will
later
not use it.
yes.
I think, some people, they keep thinking that if I take this drug, some people are planning to get rid of some people in Nigeria, so I will not take this drug.
And
I mean,
this
how
drug,
do you want
okay,
to let them know
and
that
this
it's
drug
true?
has been in the system for
Long
for like
time.
how many years ago now? So even if they want to reduce our population, ever since we've been doing that, so they should, at least the acceptability has increased compared to before,
How it
because
was before.
it's a yearly drug. It's a every year routine that okay, by middle of the year, towards the tail end of the year, implementation will surely come.
Of course, here in Ogun State, we'll have people who are not Yoruba, some are not, they're from other tribes. How do you get to tell them
Okay,
about all this?
I said it earlier on that we normally have training.
Okay.
So we will go to the local government. The community people are the one that will give us the person that will give them the drugs.
Okay.
So it's not depends on the person they give us. So our own is just to bring your people, let's train them, and we hand over the drugs to them. So they are the one that will distribute.
Okay, thank you so much for coming, Nasbisi Fanaye. We've been talking about neglected tropical diseases, and I'm sure we all have learned one thing or the other. Want to thank you so much for listening and for participating. Thank you so much, Nasbisi Fanaye from the Department of Neglected Public Diseases. All right, I want to appreciate the sound manager Samuel Odunleye, and I also want to appreciate the ICT guy Daniel Okechuku. It's been a year message for production. I am Bola Jesus, and I say take care of yourself and stay safe.